back, everyone. It's 12:55 and you're watching CT Style. So millions of Americans suffer from acid reflux, but in some cases, it's a bigger problem called gastroesophageal reflux disease, or GERD. Middlesex Hospital now has a program to treat the disease. Middlesex Health Chief of Gastroenterology, Dr. Nadeem Hussain, along with gastroesophageal surgeon, Dr. Jonathan Aronell, join us. Doctors, thank you for being here.
Thanks for having us.
First, explain what is GERD?
So this is a symptom related to acid and fluid climbing up the esophagus. A lot of times it's acid type material, sometimes it could be bile or alkaline type material.
And it's painful.
That can cause irritation, pain, yes.
Yeah. And what causes it? Is it your lifestyle, or is it more than that?
So the most common reason is the lower esophageal sphincter, the muscle at that location between the esophagus and the stomach. It can relax a little bit too much, and that can make the acid able to climb up the esophagus. Sometimes people have hiatal hernia, and that can be an issue too, where it's just wide open, and that makes it difficult for patients.
Sure. And what are the treatment options?
Well, there's a number of treatments. They typically start with lifestyle changes. Most diseases do. We start with changing our lifestyle, changing what we eat, maybe elevating the head of the bed so that you've got gravity working your side if you're having heartburn at night. And then it can accelerate to different kind of medications, antacids, that come in various strengths, from typical Tums to the purple pills, the Prilosec, the Prevacid. And then when those start failing, then there's surgical, and there are some very good surgical options that can cure this process.
Sure, and explain to our viewers what the Linx procedure is.
Well, the Linx procedure is it looks like a Smarties bracelet.
Okay.
The little candies, but they're actually little magnets on a bracelet that gets wrapped with minimally invasive surgery around the lower esophagus, and it works as a new sphincter where it can open but snaps closed because of the magnets.
That's fascinating.
It's genius.
What is the recovery time like that?
It's an outpatient surgery.
Okay.
Patients get back to eating a pretty normal diet right away. There are multiple surgeries, so that surgery works very well for some. There are other procedures. I can strengthen the valve without even doing surgery with the endoscope and operating through the endoscope. Again, the patient can go home the same day. And there are the more traditional procedures where I would tend to use a robot to strengthen the valve itself.
If you ignore this problem, what can happen to the body? Besides being painful, I mean, it's dangerous.
So there is pain, but sometimes there's medications that can help alleviate the pain and discomfort. But if left untreated, if there's ongoing reflux and injury and there's pain going on, or people are waking up at night with discomfort, then you wonder, because of all that chronic acid injury, if they can start developing precancerous type changes. So in a certain percentage of patients, they'll develop Barrett's esophagus, and in that diagnosis, usually you'll get precancerous change to the tissue there, and with that there's a risk of developing esophageal cancer. Sure,
so don't ignore it and come to Middlesex, because you know have a center that focuses on this.
Exactly.
Right? You have a number of doctors that work as a team.
Right. We've got a unified program with surgery, with medicine, with all the special testing that's implicit in making the right diagnosis.
Great. And you guys are the experts, so head over to Middlesex, and of course you can learn more about GERD. Visit middlesexhealth.org/GERD. Get the information you need there, and you don't have to be uncomfortable. Get this treated, right?
Exactly.
All right, doctors, thank you so much for being here.
Thanks.
We want to thank you for watching at home. We're in the kitchen with Courtney tomorrow cooking a holiday dessert, and we're going to stay in shape this holiday season, we hope. See you tomorrow.